Hello, everyone. This is Stephen Wellman with HIMSS. Welcome to today's session, The COVID-19 Evolution, a New Breed of Endpoint Security, brought to you by HP. Before we begin today's presentation, I'd like to establish a few parameters of housekeeping so that you understand how our presentation player operates. If you have questions for today's speakers, you may enter them in the Q&A panel in front of you. If we do not have a moment to get to your questions today, we will queue those questions up for today's speakers, and they will respond to you at their earliest availability. During the course of today's session, if you should have any questions about how to access the player, there is a help button at your disposal. This event will be made available on demand after today's presentation, and information about that will be sent to you. And following today's presentation, there will be a link to a survey. We ask if you have a chance to please take that and give us your feedback. And with that, I believe we're ready to go ahead and begin today's session. We'll be introducing our speakers just now. Our first presenter is Justine Bone, CEO, MedSec. And our next presenter will be Michael Howard, Head of Security Practice and Analytics with HP. First up, Justine Bone, CEO, MedSec. Justine, please take it away.
Thank you very much, Stephen, for inviting me to share my experience and observations. My background is in cybersecurity research and later security management. After holding the role of Chief Information Security Officer within the financial and media industries, I turned my attention to the healthcare industry 5 years ago. Myself and my team at MedSec focus on technology risk management in clinical settings, developing solutions to help hospitals manage risk in this area, especially as it relates to medical devices. No other industry has seen greater technology transformation and innovation as a result of the pandemic than healthcare. It's been fascinating to watch such massive transformation in such a short period of time. Next slide, please. So despite cybercriminals promising at the beginning of the pandemic to hold off on targeting healthcare institutions, the entire industry has come under increasing attack, with 1/3 of breaches today targeting healthcare. How do we end up in this position? Well, the reality is healthcare, more specifically our healthcare delivery organizations, hospitals, are a highly vulnerable yet lucrative target. Hospitals hold thousands of valuable records, healthcare records being reportedly worth $1,000 or more on the dark web. Hospitals are also considered soft targets by criminal organizations. They're highly complex environments with a combination of traditional IT and clinical infrastructure. This infrastructure contains equipment that has extremely long life cycles, and unfortunately within these institutions, at least until recently, we've been challenged with traditionally under-resourced cybersecurity programs. In addition, hospitals are highly sensitive to disruption. Security has to be built in, acknowledging that workflow can't be interrupted with unrealistic security requirements. Data, although it needs to be secured, must be easily available to our physicians. So this need to ensure this continued delivery of care for patients means that there's a pressure on our institutions to recover very quickly from a security incident. And we've seen this play out with ransomware attacks and the payment of ransoms in order to get hospitals back online and operational as soon as possible. What are all these attacks costing us? Well, the methodology used to determine these costs varies, but whether it's relying on cost per breached record or the cost of downtime, we know the final numbers are well into the millions. Next slide, please. So even before the pandemic, we were seeing increased sophistication on the part of threat actors. Firmware attacks, for example, have become the new normal. Back in my day of security research, we focused on the application and operating system layer. But over time, that became increasingly difficult to discover new vulnerabilities. the larger vendors started paying a lot of attention to locking down that application and operating system layer. However, at the firmware layer, we were lacking in security attention. So until recently, actually, looking at the firmware layer was a very specialized and quite unusual area of security research. Fast forward to today, with the evolution of IoT, the proliferation of devices everywhere, combined with this new, relatively unexamined attack surface, we've got a lot more eyes on the vulnerability space when it comes to firmware. So we're seeing attacks on IoT devices, cameras, routers, consumer electronics, and more. Another pre-pandemic trend was the rise in destructive attacks, becoming more destructive and executing at a larger scale. Attack operators are maturing. We're going beyond a generation of purely technical hackers to organized crime. And again, the perfect example of that is ransomware. Destructive attacks like ransomware attacks will bring an organization to its knees and halt operations entirely. And in the context of healthcare, where delivery of care overrides every other priority, the threat becomes an unacceptable risk. In addition to this, we see the continued evolution of malware. Bad guys take advantage of technology innovation too. For example, artificial intelligence. Hackers are using AI to generate increasingly sophisticated variants of malware. These malware variants will evade traditional antivirus. Hundreds and thousands, actually, of new malware variants are being created daily. So we're facing malware threats like we've never seen before. This requires a whole new approach to antivirus and traditional endpoint detection and response. Next slide, please. So circling back on healthcare, when we consider threat trends, we just have to look at emerging technology trends. There's a correlation between the two. And healthcare technology trends through the pandemic have centered largely on things like telemedicine and the underlying capabilities that enable telemedicine, such as AI. AI's application in healthcare is tremendous in terms of aiding analytics, pattern recognition, automation. As it relates to the pandemic, a noteworthy consumer-facing application of AI is chatbots or virtual assistants for screening, symptom checking, and risk scoring. We all understand that hospitals were flooded with patient needs when the pandemic set in, and this technology has helped hospitals scale quickly in response. Another consumer-facing innovation is the concept of the hospital digital front door. Hospitals had already begun to realize the need for this innovation prior to the pandemic. In fact, much was being learned and borrowed from other consumer-centric industries, such as the restaurant industry and the travel industry. But the pandemic accelerated this effort, extending it beyond a purely consumer-oriented convenience initiative to something more aligned with safety and risk management. At-home monitoring, another healthcare innovation. The benefits of at-home monitoring have also been recognized for some time, but again, the pandemic really fueled this deployment, which involves setting up patients in the home with a new set of tools that monitor oxygen, blood pressure, COVID symptoms, all with the capabilities of transmitting data back to our care providers. So these efforts, of course, created capacity for overflowing hospitals and lowered risks for patients. Another aspect of telemedicine that many of us have embraced over the last few months, virtual visits. Again, allowing easier access to care, especially for those who may not have easy physical access to healthcare facilities. And again, reducing the risk of, say, hospital-acquired infection. Prior to the pandemic, telehealth platforms didn't really live up to expectations. Patients were relatively reluctant to adopt, but COVID is now being actually considered as the long-awaited use case that has driven mainstream adoption of telehealth platforms. And there's a lot of innovation and investment going into this space as we speak. And then last but not least, patient portals, which go beyond the appointment itself, allowing continuous data access, appointment scheduling, messaging, prescription refills, test results, etc. So each of these emerging trends in healthcare introduce risk. So we're going to take a dive into what those risks look like. Next slide, please. So here's what myself and my team are seeing. First of all, data privacy protection. We've understood this priority since the HIPAA privacy rule was established nearly 20 years ago. But complexities introduced with the myriad of telehealth platforms adopted through the pandemic means we've incurred technical debt and cybersecurity risk. PHI is now being transmitted over networks that extend well beyond the traditional perimeter of the hospital into the patient home. So how do we manage and protect this sensitive data when these networks extend all the way into the patient home? We also need to consider data security in the context of other emerging trends, such as AI. As an example, a lot of COVID-related research requires patient data to train the AI and machine learning algorithms, data which must be de-identified. But in the process, de-identification is actually really hard, and the best AI algorithms have in fact been seen to re-identify previously de-identified data. So this whole process of innovation is introducing risk at the same time. Data security was and remains a very significant challenge in healthcare, but we have to be very careful not to limit our focus and look at risks beyond privacy and data. Pandemic trends such as telehealth and insecure consumer technologies become a growing area of exposure. So most at-home based consumer-grade technologies don't come with sophisticated security features built in. Or if they do, the features may be present, but they can be difficult to use and manage it. So our phones and our smart appliances and our Wi-Fi routers tend to be open and exposed. Today, these devices may be sitting on a shared network, probably without any enterprise level protections like firewalls or security monitoring, which will in turn impact the security of healthcare systems being introduced into the home. Which leads us actually to medical devices. So like IoT, medical device technology is also proliferating. Devices that were once standalone are becoming increasingly connected. Unlike IoT, these devices can impact user and patient safety. The good news is they're regulated with strict controls around emerging technology as overseen by the FDA. Bad news is we have a lot of legacy technology on our hands when it comes to medical devices. Again, this is a form of technical debt and something that the cybersecurity industry is now tackling. Circling back on AI, we must also consider potential risks of AI systems that actually go beyond cybersecurity. So, for example, advanced AI-enabled telehealth platforms, which may diagnose or recommend patient treatment options, blurring the line between a machine's judgment versus a physician's. AI and machine learning are not immune to mistakes. So we must recognize known problems with algorithmic and training data bias as well. Data bias is a real problem, risking unintended consequences and negative side effects, especially for minority groups. And then last but not least, expanded stakeholders, third-party dependencies. As a result of all this healthcare innovation, we have a whole new wave of third-party vendors supporting healthcare systems. Many of these stakeholders themselves are also innovating fast, especially given security's reputation, unfortunately, for something bolted on as opposed to designed in. We risk introducing a new wave of vulnerabilities downstream as we rush to partner with emerging vendors and platforms, especially in these areas like telehealth. In this list, you might notice the absence of ransomware attacks. This is a pet peeve of mine. The reason ransomware attacks are not included in this list is because a ransomware incident is an outcome, an incident resulting from potentially a multitude of underlying vulnerabilities in areas of exposure or risk. Ransomware is not a risk or a vulnerability in and of itself, it's an outcome. So we must be very careful in healthcare to stay focused on root cause of incidents as opposed to the incidents themselves, although that's said, they can certainly help us understand the fragility of our healthcare infrastructure and the work that we have cut out for us. Next slide, please. So I'm just going to dive a little deeper on one area of exposure unique to healthcare and clinical environments that we did touch on, medical devices. Firstly, we have a lot of them. In fact, they make up to 30% of a hospital's endpoints. The metric we often refer to, which was originally shared by the Mayo Clinic a few years ago, is around 10 to 15 networked medical devices per bed. So with a larger hospital of, say, 800 beds, that means 10,000 or more medical devices. Despite this massive footprint from a cybersecurity perspective, within a clinical environment, we have very limited visibility. Some larger devices might be well understood. They might be independently documented, managed, but most are not. Many medical devices are highly mobile. They're not well inventoried. They're certainly not well managed. And yet, they're the most critical components of our infrastructure, used to deliver continuous treatment, diagnostics, patient monitoring, and life support. The unavailability, or worse, the compromise of a medical device introduces risks to patient safety, and that is the number one concern of any hospital. And then even layering on again to our challenges, legacy devices, a huge concern from a security perspective. Some of these devices have lifetimes of 10, 15 years or more. Many are running unsupported operating systems. Most were built without security features like encryption or authentication. And then on top of that, we have extremely complex environments. There are many, many thousands of medical device vendors, product lines, product versions within any clinical space. This means that once we do understand what our infrastructure looks like, we're challenged to know where to start in terms of managing it. And this is where myself and my company, MedSec, focus exclusively on this space. Next slide, please.
Thank you so much.
This is what we open up.
Yes, Justine, I was about to say thank you so much for a great first half of this session. And with that, I think we're going to take a breather and ask a couple of questions. And the first one is up for you, Justine, and then Michael, you can add some additional context. And that question is, with a limited budget, where should I start and spend?
And that's a hard question, no doubt about it. The good news is within healthcare, we're talking about a regulated environment. Regulatory compliance is, in fact, where a lot of programs start. But hopefully we can move beyond that as an end goal. Compliance alone will not lead to a comprehensive security program. So where we need to start is looking at what are really the assets that we're trying to protect? What are our priorities? If we can evaluate those assets, then the associated threats and risks against those assets, we can prioritize from there. And this needs support. Within a hospital, technology risk management requires not just traditional IT leadership, but clinical leadership as well. So senior leadership guidance, usually in the form of some sort of a risk committee, is where we see most organizations start. From there, understanding your infrastructure, as we say, you can't protect what you don't know, what you don't understand. So getting that visibility into network topology, throughput, data repositories, asset inventory are all fundamentals. Without that, you really can't move forward. And then what we like to focus on is contextual risk. So going beyond just technical issues specific to devices, but the context, things like the potential for a device to impact patient safety, or even a device's location within a hospital. A critical dependency on a device in the ER may warrant more attention, for example, than one of many devices in an outpatient facility. So not all infrastructure needs to be treated equally in terms of risk, which is something that will help a program prioritize, especially given limited resourcing.
Great. Thank you for that. And Michael, did you have anything you wanted to add?
Yeah, I think, from the perspective of the teams that I work with and the customers that I work with on a daily and a weekly basis, it really begins with assessing your environment and knowing your environment. As all of us on the phone know, you can't secure what you don't know. And so building a comprehensive plan and understanding Where are you today? What is a good, clear baseline? And then what are your investments that need to be made as you move forward? Looking at what are the most critical areas where you need to secure and you need to be asking for budget right away to invest in, and other areas that you might be able to gradually work your way in as you're making improvements and you're bringing in different devices and you're bringing in different technology. So I think the assessment piece really gives you that visibility, and it also helps you understand where are you monitoring and managing in your environment. Do you know that environment? Do you know everything that's occurring in that environment? And again, that helps you really create what the investment strategies should be as you move forward.
Great. Thank you both for that. And I think we're ready for one more question. If we could go ahead and move on to that next question. And that question, first up, Justine, for you, and then Michael, again, if you could add some additional context. How have technology vendors adapted to the pandemic?
Well, we've adapted by undertaking, and rightfully so, very careful, thoughtful evaluations. Proof of concepts are definitely the norm. They're a very good way for healthcare institutions to trial these emerging technologies. The tricky part of a POC is defining success. Again, thinking about that outcome. So determining metrics going into that. What metrics will be used to evaluate a solution? And how does that relate to the desired outcome? Generally quantifiable, not qualitative metrics are desirable. That said, more doesn't always mean better. So the accuracy of results is also very important. And a classic example of that is security alerts. Alert fatigue is a real thing. And so we want to make sure that the alerts that we do generate are meaningful and actionable. Another element that we run into is making sure the relevant stakeholders, again, are involved. Biomed, for example, will be somewhat siloed inside some healthcare institutions from the traditional IT management team, perhaps the CISO's organization. So making sure all of those stakeholders are at the table when we go into an evaluation is very important. And then finally, integration planning. So relating to the desired outcomes. How will a solution enhance pre-existing infrastructure and capabilities? For example, how will a security monitoring platform align with hospital workflow? Security platforms are notorious at producing reports, but these reports, again, they must be actionable and aligned with hospital and patient care priorities.
Thank you for that, Justine. And Michael, anything you'd like to add?
Yeah, I think, this is a really great launching point to showing what we've done at HP, but it's certainly changed our outlooks on everything we were doing when the pandemic started. But fortunately, we had already been looking at how do you start moving into a hybrid program? How do you start protecting against the fact that users are going to start working more at home, or that we're becoming much more of a distributed workforce as we move forward? So in order to do that, it really becomes changing the mindset of corporations and how you're buying the technology that you're bringing in to handle this. And with that, I'll launch into some of the slides to show, where we've gone and where we think it's important to be investing and why we're investing in those areas. Number one of the big points that I try and drive home to every CISO and every organization that I get into is that every endpoint decision today is a security decision. You can no longer let procurement lead where you're going. You have to develop the plans, you have to develop your policies, the security controls that you need in place. And based on that, that's whenever you start looking at what you're going to acquire. And as we look at the pandemic, that started moving everything from the offices where we had full control to homes. And a lot of what we saw early on in the home offices being created is, did they have the right type of devices? Did they have the security built in? Could they push those controls out to those homes to protect that valuable data while the pandemic was going on? And also, as we looked at even in the hospitals and medical facilities, did they have the right devices in place there that they could have the security, the protection, and also the sanitization of those devices to move forward? So it became critical to look at it from all aspects. And when we look at what we've been really driving at HP for years, and it really put us in front of it when the pandemic started, is that security must be considered for every device. If it's touching your network, an IoT device, a digital thermostat, a refrigerator, a vending machine, you've got to secure it because that's an entry point to come into your environment. And as you push that out into homes, just think of the differences that you have there. You now have all of these home devices sitting on your network, and you may or may not have secured those in the right way. So education, making sure that users understood what was on their home networks, segmenting networks away from home users to what you're doing for business became critically important, and also for businesses as they were running things and moving into this new digital environment. Data and devices don't hide behind firewalls, and the firewalls just aren't enough anymore to protect everybody. When we know that 93% of attacks are happening from user errors that are going on or user mistakes, we have to come up with strategies in the security world to protect users from themselves. And when we look at that, where I like to start is always at the bottom here, is that's procuring state-of-the-art secure devices. Drive your vendors to make sure that they're giving you devices that meet the security requirements of your organization. The NIST standards are fabulous to have in place and make sure that you're adhering to those and make sure that procurement understands those standards. So as you're putting out your requests, you're really driving that. And that all gets into that cyber resilient design. How do we minimize the damage done whenever an attack does happen? How do we isolate it and make sure that we have that cyber resilience design in? And that all comes with buying the right type of devices. Justine mentioned heavily that you have to monitor and manage solutions. So again, one of the things that happened when we moved outside of that sphere of control in the pandemic is IT departments and security teams lost visibility of what was going on in their areas of control. And if you want to drive a security professional crazy, take away visibility to what they're doing. So again, how do we protect that data, the device, and then that valuable documents that we're moving around? And we know that in healthcare, those documents are extremely valuable, and we have to make sure that we're putting protections in place. Policy standards and compliance monitoring, making sure that we know we're following our corporation's compliance monitoring and we have visibility to everything. And then, of course, in the print environment, the PC environment, everything we're doing, how do we digest those syslogs that are coming in that give us that valuable information around security and pump those into our security information and event management systems so that our SOC teams have actionable intelligence on how to act against these attacks that are going on. And then, of course, moving up, it's around security assessments and the expertise. Bringing in experts to help us because most organizations don't have the right resources to make sure that they know how to protect the printing environment is a really good example. And so we want to make sure that we have the right experts and that we're assessing those environments and that we're not overlooking anything that's touching our network. Security configuration and implementation is critical. It doesn't matter which vendor you're working with, we can bring you the most secure devices in the world, but if you don't implement them in the correct way and configure them, you can leave yourself open for some real risks. So that gets into that risk management of understanding those controls, pushing those controls out, whether it's in the home, whether it's remote offices, whether it's telemedicine that we're doing today, making sure that we've established security controls that meet or exceed what our company's goals are for securing the environment. So we also look at, how do you secure with the most manageable PCs that you have out there? So again, protecting in and above the OS. So we have built in a lot of technology into our PCs and our printers so that we don't have to burden the IT teams with how do you monitor and protect users from themselves. So I'll just pick a couple out, but SureClick that's in the bottom left is something that has really protected HP as well as a lot of our customers. What SureClick does is it puts things in a containerized version and doesn't let them out. So you open up a Word document, it has malware in it. It can't leave that container. So whenever you delete that container, you've made sure you have not propagated that malware. Now, just as a point of protection there, we have had over 1 billion attacks happen against SureClick, and we have protected against 100% of those. So it's really a good technology, again, to help users protect against themselves. Some of the other stuff that's liking here, if I move over to advanced security for unknown threats, is our SureView. And this is the ability to be able to blur screens and make sure that only the person in front of it is seeing that data. So that if you have very sensitive healthcare information, you don't have to worry about somebody looking over your shoulder. And again, these are just simple things that we've built into the devices because we don't think organizations should have to add software for everything they're doing that help users protect themselves against themselves. When we look at the print environment, again, it's very critical that we look at these devices largely are overlooked in most organizations. And so how do you protect yourself against the vulnerabilities happening there? We have built-in runtime intrusion detection with the ability to self-heal when we see an attack going on a printer. Somebody may be using that printer purely to get on your network and then do a lateral attack from that. And we detect that and make sure that we're shutting that down. We have Connection Inspector where we're looking for anomalous behavior. And who better than HP to be able to detect what's normal in a print stream and what's not normal in a print stream. And we can look for that anomalous behavior and again, get that device off the network, do self-healing for cyber resilience, and then bring it back up in a safe state. But at the same time, pass over that actionable intelligence to the SOC center so they know what's going on. Our security manager that we have is keeping compliance of those devices, those printing devices with a common operating system. So before they hit the network, we know for a fact that they're being protected and that they're in a safe state. And then as you move around, integration with SIM tools. It's every bit as important to integrate every single endpoint you have touching your network into the SIM tools so you can detect anomalous behavior, make sure that you've got everything locked down. We inspect at the BIOS level, both on our PC and our print side with SureStart, making sure that the BIOS is clean as you come up. We offer secure defaults out of the box because we know that sometimes misconfigurations can create a breach. So how do we help you as we do that? And of course, encrypting data and protecting whitelisting and protecting the firmware is also critically important in what we do. So when we look at it, though, it's not just about the technology. You can buy the best devices in the world, but it's also about the people and the processes. And so who does stuff and how is stuff getting done? And that's become critically important in this new pandemic world because we're doing stuff differently. We have users that are interfacing with devices from remote sites that we have never done before. So analyzing that, understanding how you do that, is just as important as bringing the right devices in. And to that end, we have created a lot of advisory services that we have pushed out to the remote world so that we can help companies organize and develop their standards. So our security advisory services allows us to give great visibility of what the current security posture is for a company, identifies security risks, helps identify appropriate activities, and then create a security roadmap so you have some actionable intelligence on where you want to go and what are your investments. As we were talking about the investments, how do you invest if you don't have the knowledge of where you need that investment to be? Implementation services, I talked about that. Not every company knows how to secure a print environment or a PC environment at the very best levels. So use expertise that you can bring in that can help give you that advice to make sure that you're configured right. We have a lot of operational services at HP as well, like our governance and compliance service to make sure that you're staying in compliance, our syslog management service to make sure you're digesting actionable intelligence from those devices and that you know how to deal with that information. Firmware, as Justine talked about early on, we're still seeing a lot of attacks from firmware. It's on the rise. How do you make sure that you have a service that's keeping your firmware up to date, that you're not leaving yourself open to a vulnerability, even for a 5-minute period? So making sure that you understand that and that you know how to feed that information into an incident response team and know that you've got updates that need to be done. And then, of course, reevaluating. And that's where we talk about our retainer services, is making sure that we're doing follow through and we understand those environments and we're constantly looking at how we can make improvements to an environment to keep everybody safe. So some of the key takeaways and the things that I really try and drive home to all of my customers is remember that every purchase decision is a security decision. We changed that model at HP about 5 years ago to where we don't buy anything that's going to touch our network unless we understand and have the security teams involved early And we know that they're going to meet the recommended requirements that HP has put in place to keep our company safe. And I recommend that every company do that and change that buying habits that we have. Assess, assess, assess. Every time you assess your environment, you're going to learn from it. You're going to get actionable intelligence, and you're going to be in a better position. Analytics are critical, so making sure that you have devices that are giving you that actionable intelligence in every endpoint, whether it's a digital thermostat, a vending machine, a printer on your network, a PC, making sure you know what they're doing and you have the analytics around to monitor and manage that. And then that gets into the monitoring and management. If you have vendors bringing you devices that you can't actively monitor and manage, and I'm talking about even printers, digital thermostats, any of that, you need to push back and make sure that you're buying the right devices that are going to give you that intelligence as you go through. And with that, Stephen, I'm going to turn it back over to you.
Michael, thank you so much for that. And with that, I believe we are ready for some questions for both of our presenters today. And I think I'm going to start with you, Justine, with this first question. And Michael, please jump in as soon as she's finished. That first question for you, Justine, what are the differences between a CISO security program inside a hospital versus, say, a financial institution like a bank?
Great question. Thank you, Stephen. There's a lot to be learned within healthcare from other industries, such as the financial sector. However, there's also a lot that's unique to a healthcare delivery organization in particular. Number one being the delivery of care and the protection of patient safety. So a good example of that would be, within my domain, medical device infrastructure. We need specialized technologies to assess and monitor security within these environments. Why? Well, what we've seen is security technology, for example, vulnerability management, vulnerability scanners that work well in other environments are actually introducing a level of uncertainty that represents an intolerable risk inside of a hospital. Active scanning, because of these legacy devices within the infrastructure, active scanning can actually negatively impact those endpoints, causing medical devices to freeze, to reboot, to behave erratically. That's not an acceptable risk inside of a hospital where those medical devices may be in use, actually delivering care to a patient, which is, of course, a 24/7 operation. So as a result, we've built specialized security monitoring technologies that are safe inside of these clinical environments, that have zero risk of impacting that infrastructure. So that's an example of where a slightly different technology approach is necessary within a healthcare institution. But at a governance level, in terms of getting stakeholders involved, in terms of briefing executive leadership, there's really very little difference. We need that buy-in from the top down in order to get a security program up and off the ground.
Great. Michael, anything?
Yeah, well, I can tell you, I get asked this question all the time across all industries. And for the most part, in security, what we're trying to do is keep the bad people out. And that's the bottom line. However, when you get under the covers, how we're doing that at different organizations is a little bit different. So in financial organizations, obviously, we're protecting user data as well as financial data, as well as financial transactions. And those are all, you're using similar technology to do that. You move into the healthcare industry, obviously patient care is the most critical and important. And sometimes you have to be a little more lax on security to make sure that you have that healthcare concern and that patient care at the highest level. So with that, it means that you may want to put in different types of security levels in those so that you can protect against that in a very quick way, or you might have to be a little more agile. But I agree with Justine for the most part. Security is security, and you're trying to keep the bad guys out. So all of us are doing it in a very similar way. We're just applying it slightly different in a different method as we're behind the scenes.
Great. Thank you both for that insight. Next question. In your opinion, what is the most important first step we can take to implement a better cybersecurity posture? Michael, if you want to take that one first.
Yeah, I think, again, that gets back into understanding your environment. So really knowing, number one, what are the regulations and the compliance rules that you need to comply with, understanding what's in your environment. I can't tell you how often my team goes into environments and the first question is, how many endpoints do you have that are touching your network? And I can tell you most organizations are off by a factor of they may understand 60% of what's touching and 40% is not. And that's routine when we're doing assessments. So getting your hands around what's there, what are you trying to secure, becomes critically important as a first step that then allows you to start building plans out of where you want to go.
Great. Justine, anything you'd like to add?
I completely agree with Michael's points. In addition, I would say again that executive buy-in. Gone are the days where prevention is the first and only approach. We need executive leadership to understand that cybersecurity is risk management. It's a continuous process. We're never done. But there are still perceptions out there that this is something that sort of can be solved and then we can move on. So getting your executive leadership team up to speed with the reality and the risks and the approach forward, and hopefully getting them invested in the outcome is going to really set you on the path to success when you roll out these technologies for visibility and monitoring and assessment.
Great. And then I think we only have time for one more question. And that question is, how overlooked is the print environment end to end as it relates to cybersecurity? Michael, you were talking about print earlier. Maybe you want to start on this one.
Yeah. Oh my goodness. I can tell you every single time we do an assessment around a print environment, I am blown away by how overlooked it is. And I can tell you we have done hundreds of assessments in print environments around the world in major corporations. And on average, and this is an abysmal number, is about 54% of organizations have even taken into consideration their print environment. Leaving just a wide gap of easy access for people to come into environments and get on. So I think, if you look at the IoT world, I always say printers are probably the oldest device in the Internet of Things and has the most out there and is the most overlooked and the easiest way for a bad guy to get in and do a lateral move and usually not ever be detected around that. So we see the stats, we know they're real, and we're really trying to drive that point home.
Great. And Justine, any final observations on the printer security issue?
I would just say within healthcare, that's more relevant than ever. Healthcare environments are still very paper-centric, and the print footprint is significant. It's definitely a large segment of infrastructure that needs protection and security monitoring.
Great. Well, I believe we're at time. I want to thank our participants today, Justine Bone, MedSec, Michael Howard with HP. I want to thank our sponsor, HP, for making today's very informative session possible. And I want to just give a couple of words of advice and insight here as everyone wraps up from today's session. Just a reminder, if you did enter questions in today's session and we did not get to them, we will get those questions over to today's speaker, and I'm sure that both of them will respond to you as soon as they can. And just a reminder, at the end of today's session, there will be a link to take a survey. We ask that you please share your thoughts with us so that we can use your feedback to continue to improve the quality of these sessions. I'm Stephen Wellman with HIMSS, and I thank you for joining us today.